Welcome to today's presentation, where we tackle the subject matter of physician burnout and how slight changes in your daily administrative workload can counteract the stressors causing it. Just a quick disclaimer, UpDocs in no way believes that implementing technology solutions in your practice can or will cure the severity of physician burnout. Our claim is simply that implementing the right solution might act as a preventative measure. Let's get started. Dr. Raj Pruthi states that burnout in medicine is a national, complex, and systemic issue whose effects go far beyond physicians themselves, impacting our patients and even having far-reaching societal implications. Sadly, across the world, I believe that physician burnout is becoming the norm within our career path. It's clear that burnout is becoming more and more common among physicians and residents all over the world. The expectations set on independent physicians, physicians in hospital, and residents are not subsiding. So the consequences for your overall mental, physical, and family health are really costly. But burnout does not discriminate when it comes to who it affects. In a recent Medscape Physician Lifestyle Survey of more than 14,000 physicians, it was stated that 40% felt burnout in 2013, and then that rose to 46% in 2015. And then a staggering 51% of you reported feeling some type of burnout in 2017. We've seen that over 54% of physicians state that they have felt or feel some type of burnout currently. That's a scary, scary number, and a drastic jump over the years. Individuals like yourselves go into healthcare to help people, to help sick people. What is it about the daily grind that results in so many to feel affected in such a negative way? We've looked at the top causes, and they seem to be the climbing drug prices, reporting on pay for performance, so moving from volume to value-based care, mandated EHRs, the learning curve involved with those, and then having to report within your EHR every day, pressure of patients and colleagues around you, work overload, and excessive administrative challenges. Obviously, the expectations set on independent physicians, their staff, and the people around you are not necessarily going to go away. So what exactly can you do to start alleviating some of these burdens? The symptoms of burnout are likely to affect your performance and staff satisfaction. Some of the warning signs that you can identify if you're possibly feeling burnout would be depersonalization, marked by periods of feeling disconnected or detached from your body and thoughts, emotional exhaustion, a state of feeling emotionally worn out or drained as a result of accumulated stress from your personal or work life, and extreme fatigue. This is a lingering tiredness and is constant and limiting. As healthcare providers, I'm sure you have seen or prescribed something for some of these symptoms. But how can you do that when it's you that is suffering? So what is the solution? Again, we are not claiming that implementing technology can cure burnout, but we can definitely help identify some of these contributors, or at least subtle contributors, and making small changes can limit the impact it has on you and your health. Dr. Claiborne states that the problem is that burnout is not a problem that we can diagnose or fix. It's an ongoing perplexity that requires an ongoing structure for balance and self-care. So what can you do at your practice to help alleviate some of these stressors without trying to put a Band-Aid on anything? Subtle improvements can definitely help make your day a little bit more feasible to get through. Maintaining balance can begin addressing root causes. Listen and create structure in your practice. First, acknowledge that there is a problem. Acknowledge that you may be feeling a certain way that's not necessarily the most positive for your staff or your patients to be around. Listen to your frontline doctors. If you're an administrator or if you are the owner of a practice, listen to your doctors. Help them figure out exactly what they can do to make their days a little bit better. Ask how are you and truly listen. Be a team player, be a friend, be a confidant for someone. Additional staff training and structure. Adding that structure with your staff and making sure that they are hip to the nuances in the technology you're using, that they know all of the regulations coming at them in advance, that if you plan on reporting for MACRA and MIPS or any of the federal regulations coming your way, make sure that they're all trained and ready for those changes as they come down the pipeline. And also implementing process to limit stress. Right now, we're going to tap into the patient engagement initiatives that might ease up some of your staff's time as well as some of your time spent on the phone every day or trying to contact your patients or track them down. The harsh realities of traditional patient engagement are that you're spending too much time calling your patients and they aren't answering. Studies say that it takes up to 3 attempts to get your patient on the phone. This is stressful. This is bogging down your staff time. They can't help your patients and they can't help you if they're tied up on the phone all day. Your patients and consumers in general want and expect convenience. Patients are acting as consumers. This is a growing trend that is not going away anytime soon. They want you, your practice, everything at their fingertips. If they have a question about a treatment plan, if they have a question about a rash or a headache that's lasted too many days, they want to be able to communicate that to you in an easy and an efficient way that doesn't have them leaving the comfort of their own home. And your staff is overwhelmed, and engagement initiatives with patients might not be the top priority. Many of the staff that we've surveyed recently definitely are worried about the productivity in your practice, but don't necessarily have the answers to counteract them. With engagement tools like text, automated appointment reminders, tailored broadcast messaging, online scheduling, pre-populated patient forms, and patient payments all online, your staff will have access to everything in one place, making it easy and simple to use and automating different workflows in the background without having to slow down their day or take away time from that patient interaction. Your staff is provided the tools and solutions that will better enable them to provide the best care to your patients outside of your patient encounter. Did you know that 97% of Americans use text messaging? Or that 90% of texts are read within the first 3 minutes of receipt? That's crazy, especially when you're trying to get in touch with your patients. Those 3 attempts it would normally take you to track down your patients by phone now just became easy as 1, 2, 3. With secure text, you get patient satisfaction. You meet your patients exactly where they already are, their mobile phones. Time savings, it's faster and easier and a more effective way than calling with 2-way secure text. There's an audit trail to file conversations to the chart. Versatility, both staff and patients can send attachments back and forth in a message. Here's how you would compose a secure text. Within the UpDocs inbox, where all of your solutions live, you'll simply hit the compose screen, pick your number, and send to your patient. From there, they have to verify their identity by typing in their birth date. Then they can see your message and exchange messages with you back and forth. So how is it being used by other providers? You can use pictures and videos to capture patient symptoms rather than relying on descriptions, making it easy for patients to submit insurance cards, forms, or billing items. You can send patients educational materials for pre-visit strategies or lab results and copies of their medical records. You can also alert when patients need follow-up care or also follow up with them after that follow-up is done. Next, we have broadcast messaging. This is just a way to tailor messages to any and all of your patient population, to conveniently send out a specific message or a templated message to drive patients into increased reimbursement. So it could be to chronic care management patients, call them in for immunizations, physicals, backfill your appointment slots. We also help with staff satisfaction to save hours off the phone chasing down patients. Patient adherence, we can prepare your patients ahead of the appointments and deliver follow-up information after. And also right back to that convenience, less phone tag for your staff and less phone tag for your patients. And versatility, customizable messaging to deliver on the fly by phone, text, or email. Just like you would the secure text, right in your UpDocs inbox, you're able to access in the admin tab your broadcast messaging. From here, you can pick a template, pick your list, or you can create a custom message based on the message you'd like to convey to your patients. From there, you simply click your method and send your message. They receive it the same way they would a text message from your practice. The only difference is they cannot respond to a broadcast message. So depending on how you'd like to communicate with your patients, you have ease of use here, you have customization here. You just get to choose whether or not you'd like them to respond. So how exactly is broadcast being used? You can tailor messages to distribute information to your staff, patients, or your referral sources. Deliver education on what to expect before a patient's upcoming appointment to guarantee the most enriching experience for them. Update databases on new services to boost revenue. And stay front of mind with birthday messages and inclement weather notifications. The last solution we're going to tackle in the patient engagement side truly adds the most value when it comes to your staff time being taken up by phone calls, trying to track patients down, and trying to get your patients into the practice for appointments. Specifically, our reminders are completely automated. It is a one-time setup, and then they will just run in the background from there. And what we provide is revenue improvement, fewer no-shows, greater reimbursement, and less wasted appointment slots. Visibility. You can backfill appointment slots by giving patients confirm or cancel options. Staff satisfaction to save those hours off of the phone. Personalization, a custom reminder by appointment type or location. Patient convenience, again, less phone tag. And versatility, customizable messaging to deliver on the fly by phone, text, or email, all automated in your practice. If you'd like to get to the reminders portion of UpDocs, in your one-time setup with our support team, you're able to click your method. If you have a higher senior citizen demographic at your practice, a lot of times you will just want to either phone call or email them, and you can definitely do that here. Everything is dependent on the preferences you have at your practice as well as the preferences of your patients. And with our solutions, we also carry an audit trail. So you're able to differentiate between providers, figure out what methods are working for your patient population, whether or not your appointments have been confirmed or canceled. You can see all of that here to see trends, follow up in timely manners. If they have confirmed or canceled, if they have canceled, you can get them back on the calendar. And now how exactly is it being used? You can automate reminders to eliminate redundant work, reduce no-show rates and create a predictable schedule, increase visibility into scheduling without being inside of the practice, and allow for cancellations and confirmations within the reminder. Outside of our patient engagement platforms, we also provide a communication and a productivity suite. With communication in the same inbox you would be using for reminders, you will have your electronic inbound and outbound faxing. Soon to come, UpDocs Messenger to enable team collaboration, direct messaging, and secure email. In our productivity suite, we provide the inbox, where you have all of these solutions in one place. The directory access, you have access to over 1.2 million providers. We are the second largest HISP in the nation. We help you prioritize, organize, and touch your workflow just once within the inbox. And then document editing and citing. Document editing and signing, all within the same inbox you're using for your patient engagement initiatives and your faxing and communication. You can also edit documents, pull them directly into UpDocs, and then push them out in a manner that you prefer. UpDocs truly is one place to do everything that your practice requires when it comes to communication, engagement, and productivity. UpDocs helps you streamline the manual process, empower patients in their care, generate new revenue, and drive provider relationships. Christine Sinsky, MD and Vice President of Satisfaction at AMA, was featured in a Modern Medicine article stating that she's begun implementing specific workflow changes that put 3 to 5 more hours daily back into patient care. This is truly what we're driving for. We aren't here to put a Band-Aid on your problems. We aren't here to try and sell you a bunch of things that you might not use. UpDocs is truly here for the providers and their staff. We want you to feel the best so that you can deliver the best care possible to your patients. UpDocs is one platform with multiple solutions to do the work of 3 to 5 business partners. To learn more, feel free to contact us at the number and email below. Thank you.